Brendan is a research assistant at the BC Injury Research and Prevention Unit. He majored in psychology at the University of British Columbia and earned a Bachelor of Arts.
No, other way around. You're using it.
Earned a Bachelor of Arts degree in 2021. Brendan joined BCIRPU in the fall of 2022 and helps provide evidence syntheses on different injury prevention topics, including road safety, fire safety, and sports injuries. He started reviewing the e-scooter literature a few months ago and worked with his colleagues to develop a presentation on how to prevent e-scooter injuries. Kirvy is the injury prevention lead from British Columbia Centre of Disease Control, BCCDC, and Vancouver Coastal Health. He has an undergraduate degree in psychology and developmental studies from the University of Winnipeg and a master's in international public health from the University of Liverpool. Kirvy has worked in different fields of public health, such as immunization, tuberculosis, harm reduction, and disaster management. His interest in injury prevention started when he moved to Canada over a decade ago and taught new immigrants and refugees about injury prevention. Kirvy strives to incorporate equity, diversity, and inclusion in injury prevention practice. If you have any questions during the presentation, please enter them into the chat box at the bottom of your screen. After the presentation, you may unmute your audio line to ask questions, or we will monitor the chat box for questions and any comments you may have.
Yeah.
We're now ready for the presentation. Kirvy and Brendan, over to you whenever you're ready.
All right, thanks, Anita. All right, so hello, everyone. As mentioned, today's webinar is called A Safe System for Electric Kick Scooters. And just so there's no confusion, we'll be using electric kick scooters and e-scooters interchangeably throughout the presentation. So just to clarify that, but without further ado, let's get into it. And just before beginning, I want to acknowledge that today I'm going to be presenting from the ancestral lands of the Tsleil-Waututh, Squamish, and Musqueam peoples. And I encourage those tuning in to also acknowledge where they're coming in from today. I'll also pass it to my fellow presenter to acknowledge where he is coming in from today as well.
Thanks, Brendan. I'm grateful to call in from the traditional and the unceded territory of the Coast Salish peoples, specifically the Katzie, Kwantlen, and Semiahmoo First Nations.
And just as a short introduction, again, my name is Brendan. So I'm a research assistant at the BC Injury Research Prevention Unit, as Anita mentioned. And I joined the unit in the fall of 2022. And not too long after I joined, I got involved in a literature review on e-scooter injuries. And so that's what led to my involvement in the webinar today. I'll pass it back to my fellow presenter to introduce themselves as well.
And I'm Kirvy Quiambao, the Injury Prevention Lead from BCCDC and VCH. I'm also a member of the BC Injury Research and Prevention Unit, working with Brendan. Thanks.
Okay, so just an overview of what we'll go through today. We'll start off with just a brief background on e-scooters, just give some basic information. And then we'll transition e-scooter injuries, looking at what the literature says so far. And then I'll pass it off to Kirvy just to finish up with talking about injury prevention and what that might look like for e-scooters going forward. Okay, so e-scooters, they're defined in BC as devices with up to 4 wheels. They have a steering platform or steering handlebar, a platform where the individual rider would stand on. They have at least one electric motor and at least one electric battery. And in BC, the speed is capped at 24 kilometers. So e-scooters that are allowed on roads should have a maximum speed of 24 kilometers. Again, if you're coming from outside of BC, this may not be the same as in terms of legislation, but most e-scooters would fall under this criteria. For example, as you see here, most e-scooters would just have 2 wheels. Now, one of the first pilot studies in Canada with e-scooters happened at Waterloo University in Ontario. And what they saw there at Waterloo is similar to what we see now in terms of user ridership. So riders, they tend to be male, and they tend to be between 20 to 40 years, individual riders between 20 to 40 years. As far as why people use e-scooters, common reasons include commuting. So in the case of Waterloo, that would be students getting between classes and such. Another reason why people might use e-scooters is also for recreational purposes. So this could be like a ride in the afternoon, for example. Now, the rides themselves, they don't tend to be very long, and they tend to be near areas where there's infrastructure to support their use. So on the left here, this is a graph from Calgary Data, another city in Canada piloting e-scooters. And just to explain these two numbers here, so this first number is 0.5, and that's referring to the distance. So 0.5 kilometers or half a kilometer. And then this number here is 23,503. So that's the peak of this curve here. So the highest number of trips, or the distance with the highest number of trips, is at half a kilometer. So again, not very long trips. And then on the right here, this is a map of the city of Kelowna. And what it's showing is, based on the shade of gray, it's showing the number of observed counts for e-scooters in different areas. And so the darker the shade of gray, the more number of counts in that area. And so you notice the darkest shade of gray is this area here. And the magenta area right here, this is the city center of Kelowna. So one possible reason why more counts are in that area is probably because there is more infrastructure in that area to support the use of e-scooters there. And as well with trips, more trips seem to happen at night and on weekends. And so again, these two graphs or set of graphs are from Calgary Data again. And what it's showing is the demand of e-scooters by hours of the day here on these set of graphs. So it's 0 to 23 by hours of the day. Top one is just Monday through Sunday, so days of the week. And then this is just an overall distribution of the 7 days of the week. And in general, what you notice is that, demand starts to rise in the morning, peaks around 5, 6 in the evening before steadily falling down. So more trips seem to happen at night or evening time. And then on the right here, this is just the similar data, but just in a different form. So this is by demand by days of the week. And again, demand rises as the week goes on and then peaks around Friday, Saturday, so on the weekend and such. Okay, so that's just a brief background on e-scooters and what their trips look like. Now we'll get into e-scooter injuries, or what the literature has shown so far for e-scooter injuries. And I'll break this section up into two parts. The first part will be looking at the burden of e-scooter injuries. So that will be, how frequently are these injuries happening? How are these injuries happening? And the second part will be looking at the risk factors involved. So these will be factors that might make someone more at risk of getting an e-scooter injury. And so the first piece is, how often are people getting injured on e-scooters? And there seems to be a range in the literature for how often these injuries happen per 100,000 trips. And so this range here is a range that is taken based on many different data reported from different cities. And this is a good table just illustrating that. I'll mention that for the injury definition here, this is ED visits. So an injury where the individual has to go present at a hospital or go to an emergency department. That's what the injury is defined as. Now, I know there's probably some people wondering, how does this rate compare to, say, cycling? And this table does do a good job of mentioning some cycling injury incidence statistics as well. And just a couple caveats here is, of course, there's different injury definitions, and then methodologies can also be difficult to compare just based on what was reported in the literature. But I'm happy to come back to the slide afterwards and elaborate a little bit more on this as well. Now, as far as what parts of the body tend to be most vulnerable or susceptible to e-scooter injury, they tend to be the head, the arms, and the legs. And so these two images here, this is just an image of general injury location by percentage breakdown. And so you notice the upper limb, so the arms, lower limb, the legs, and then the head neck area are notable here. And then on the right, this is an image where it's representing a certain type of injury, so a fracture injury. You do notice a higher percentage of injuries in both the upper limbs, arms, or lower limbs, legs, with fracture injuries, so like a broken bone, for example. Now, given that riders tend to be males and individuals between 20 to 40 years, it seems that injury cases with e-scooters seem to involve these demographics as well, or tend to involve these demographics. The interesting piece is, if you adjust the data by how often people are riding or by exposure rate, you do notice that older and younger age groups seem to have a higher injury risk or injury rate. And so this graph here was taken from Portland, Oregon's pilot study or pilot data, and it shows that with 16 to 19-year-olds as well as 60 plus, they have a higher injury rate compared to the other age demographics here. So an interesting piece in terms of injury profile for users. Now, as far as how people are getting injured, the most common way is by falling from the e-scooter. The other way is by traffic collisions. And again, they're not as common as falls, but the idea around traffic collisions is that they can lead to significant injury events. So like a traumatic brain injury, a fatality and such. Anecdotally, from just reading news reports on e-scooter fatalities, I tend to read that, the rider was, they weren't wearing a helmet, or, they collided with, say, a motor vehicle. I believe in Canada too, there was a case where a young individual, they weren't wearing a helmet and they collided with a truck, and unfortunately they passed away. So again, collision injuries, even though they aren't as common as falls, they can lead to significant injury outcomes or events. Okay, so now the second part is going into the risk factors involved in injuries. So what factors might make someone more at risk of getting injured on an e-scooter? So for this section, I'll just explain the risk factor itself, and then I'm going to compare it to the legislation we have here in BC. Again, if you come from outside of BC, I do encourage you to share your perspectives and experience with e-scooter afterwards, just so we don't just stay within BC for the whole presentation. But for this part, I'll just compare it to what's the legislation is in BC and see how it seems to address the risk factor. And so, like in road safety, or most of road safety, speed is a risk factor. And what I'll do to start with emphasizing speed for e-scooters is this part, or these set of images here. So these were taken from a simulation study for e-scooters. And what this study did is it simulated a rider colliding with a curb or hitting a curb and falling. And so they did this at different speeds, and they looked at if the rider was wearing a helmet or not. And so just to explain these different images, they looked at head injury as the outcome. So these were the different head injury measures. So it's linear acceleration of the head, angular acceleration of the head, and then the measure on the side here. Down below is the velocity that the rider is traveling at before they hit the curb. So that would be 10 kilometers an hour, 20, and then 30 kilometers an hour. The red dotted line is the threshold for injury. So with this, if the bar is above the red dotted line, that means that they're above the threshold for injury, likely to get injured. And then if the bar is below the threshold, they're below threshold for injury. The white bar is the simulated rider who did not wear a helmet. The gray bar is representing the simulated rider who did wear a helmet. And just in general, when you look at these different images, you notice that what you see is at 10 kilometers an hour, the white bar is above threshold in most of these cases. The gray bar is right around threshold at 10 kilometers an hour. But by the time you get to 30 kilometers an hour, you notice that the white bar is above threshold in all these cases quite a bit. And now you notice that the gray bar is above threshold in most of these cases as well. So the key takeaways being, number one, wear a helmet, because there are differences here between the simulated rider who did not wear a helmet versus the one who did. But the other piece too is at higher speeds, you do notice that even if the individual were to wear a helmet, they're still above threshold if they were to hit a curb and fall going at that higher speed. Now in BC, again, the default speed limit is 24 kilometers, or that's the maximum speed for a regulated scooter, or for scooters that are allowed on our roads are able to go. And so that's as where our speed is in terms of legislation. Now for helmet use, or sticking with helmet use, this is one of the ones that's been reported or has come up a bit in the literature, and that's low helmet use rate among e-scooter riders. And I'm happy to elaborate more on this as well later in terms of some of the differences between if the rider's, say, on a private e-scooter versus if it's a rider using a shared e-scooter, because there seems to be some helmet use differences there. There also seems to be some differences depending on whether the community has helmet legislation and how that can affect helmet use in those places. In BC, you must wear an approved bike helmet while riding an e-scooter. This aligns again with our bike helmet law in BC, where you must wear a bike helmet while riding a bike. Now, where you ride can also be considered a risk factor for e-scooter injury. And this one sort of matches up to how people get injured. So the injury rate for e-scooters is higher on sidewalks. And, I suspect this could be because there's more of a chance of falling there, uneven pavement, there's pedestrians walking around. So the e-scooter riders trying to maneuver around them, and that could lead them to get off balanced and maybe leading them to falling or lead them to fall. But of course, the other side of that is on roads, there's that chance of a traffic collision with, say, a motor vehicle, and those can lead to significant injuries or more severe injuries. Now, in BC, legislation-wise, you cannot ride an e-scooter on the sidewalk, the exception being if the pilot community bylaw allows this. So the pilot community is responsible for, deciding where the e-scooters can be ridden in their community. And then if they decide e-scooters can go on the sidewalk, then they can then be ridden on the sidewalk in that community. But again, the default in BC is that e-scooters cannot be ridden on the sidewalk. Okay, so this risk factor is an interesting one, and it might be tied into the risk factors I'll talk about afterwards. So riding at night is a risk factor, and as an example, use a study out of Calgary when they looked at their pilot data, what they found was that about almost 50% of injuries, e-scooter injuries that led to urgent care visits or ED visits, they happen between 8 p.m. and midnight. So presumably those incidents would have been happening around that time. In BC, e-scooters are required to have lights. And because they're required to have lights, they then can be ridden at all hours of the day. However, if e-scooters do not have lights, which in BC they are required to, then they can only be ridden between half an hour before sunrise until half an hour after sunset. Now, the risk factor this riding at night might be tied into is impaired riding, or some of the behaviors that might be happening at night. And so alcohol use has been looked at quite a bit in the e-scooter literature. Substance use, not as much. Alcohol use has been looked at, and there has been some evidence that alcohol use can affect driving performance on e-scooters and possibly also increase the chances of head trauma head trauma injuries while the individual is intoxicated while riding an e-scooter. In the legislation in BC, there is an explicit section that clearly states do not ride while impaired, but they do have a couple of sections that cover this in terms of you must ride with due care and attention, or with reasonable consideration for other persons, which again, if you are intoxicated, that would affect those abilities. The other case is also distracted riding. Now, this one hasn't been looked at as much as I would say alcohol use with e-scooter riding. However, it's still considered a risky behavior. And examples could be, if there's more than one rider on the e-scooter at a time, or if the e-scooter rider's looking at their mobile device or phone while riding, those can be distracted riding behaviors. And in BC, the legislation does address this. So you must not use the e-scooter to transport someone else. And you must have at least like one hand on the handlebar as well. So again, these as ways to prohibit or discourage the use of these risky behaviors while riding. The last risk factor I'll mention is experience level. Now, you may have heard of this risk factor before in terms of the idea around within your first 10 trips on an e-scooter, that's when you're most likely to get injured. And that statistic came from, or that finding came from the city of Austin, which was one of the early ones to pilot e-scooters. And this is the graph here that was related to that finding. And so in BC, there isn't a license requirement to ride an e-scooter. There is no training requirement as well to ride an e-scooter. There is an age requirement where the rider must be 16 years or older before they can start riding. I will mention that there has been events in BC that I know of where they've had free e-scooter training. So if people have wanted to, learn how to ride an e-scooter, they can go and attend free e-scooter training and such. But again, this is where our legislation at least stands right now in terms of experience level. Okay, and so with that, I'll now pass it on to Kirvy to finish up with a discussion about injury prevention.
Thanks, Brendan. That was really informative. So continuing on our presentation, injuries from riding e-scooter is an emerging public health concern. But there are questions whether it could be a potential solution for our transportation gaps. Now, in this section, I'll discuss briefly existing literature, safe systems approach on e-scooter, and how e-scooter play a role in equity and social determinants of health. Next slide, please. So unfortunately, research on e-scooter injury prevention intervention in particular is still in its infancy. A lot of research looks at incidence, prevalence, burden of injuries, and other factors, but not as quite as with interventions yet. I found several reports from transportation research in the US, European Transport Safety Council report, and the International Transportation Forum, which provides a good overview of behavioral safety issues on e-scooter, how communities respond to prevent injuries, and recommendation on e-scooter safety. I highly recommend reading some of these reports because they really provide a lot of good information, and some of them I will be talking about as we go on. So since e-scooters are becoming popular on the roads, we must consider how this form of travel interacts with other road users. There's no better way to look at it through the safe system approach lens. We're going to look at safe riders and roads, how speed influences injuries, and look at safer e-scooters. Next slide, please. So we can start looking at safe riders based on the BC provincial e-scooter pilot regulations that stated riders should be at least 16 years old and older, and helmet use is mandatory. However, enforcement is a bit of a challenge for most jurisdictions participating in the pilot program. I can't emphasize enough that wearing a helmet protects riders from head injuries. As we have learned, research on e-scooter revealed that head injuries are the most common and severe injuries. While little evidence shows the impact of actual helmet loss versus actual use, we need to keep educating the public on helmet usage and brain health in general. Some operators provide discounts for people wearing their helmets by asking a rider to take a photo of themselves, or even using artificial intelligence to determine if the rider is using a helmet using the helmet detection technology. Now, it wasn't clear though from the reports and how the artificial intelligence, it describes the use of AI, but it sounds like you still have to take a photo before riding and after riding the e-scooter. Now, if this kind of technology is successful and then there's no issue on regulation, which I would assume it's the privacy issue, the operator can bar riders from using the e-scooters. In Washington, DC, operators are required to provide helmets upon request by the user, which I think is a nice program. But I think the best thing about helmet wearing is that it gives you protection whether there is a separated bike lane or e-scooter lane provided. Now, we also heard that impaired and distracted riding, similar to driving, is a risk factor for injury. Imposing a penalty can potentially deter such behaviors, but this should be supported by sufficient enforcement. It doesn't look like if a cyclist, or if you look at cycling rather, a cyclist can get fined for DUI, but can for other reasons, such as careless cycling or cycling without reasonable consideration. Falls are the most common cause of e-scooter injury. So balancing an e-scooter is challenging for someone intoxicated. And I'm sure some of us here, or personal experience, or someone that even walking while intoxicated is hard enough to find that balance. For a shared e-scooter, a nighttime ban is one way to prevent injuries with alcohol use. In Atlanta, rental e-scooter are disarmed or disabled at a particular time at night, and that was between 9 p.m. to 4 p.m. The study showed there's a reduction in ED visits between those hours, but not highly significant. But still, there's still a reduction. There were some reports where operators actually use smartphones to detect impairment through measuring reaction time and accuracy, while others are working on monitoring excessive wobbling, and that would slow down the e-scooter. And I believe this is what Lime is currently doing. Now, a report from the International Transport Forum recommends having a systematic approach in addressing impairment, not just focusing with e-scooter. So intensifying education and enforcement campaigns to reach all road users. And for distracted driving, as Brendan mentioned earlier, the use of mobile phones or having a passenger could be a distraction and can lead to injuries. Now, when we talk about geofencing, so geofencing, for those who are not familiar with it, uses GPS or the RFID technology to create a virtual geographic boundary. So the software triggers a response when the user leaves a particular area. How it is used on an e-scooter is it can be set up to slow down or to stop the e-scooter in identified slow zone areas or sidewalks where micromobilities are not allowed. And this is to minimize interaction with other traffic. This can also be an alternative to nighttime ban. Instead of a disabled e-scooter, an e-scooter would only operate at a slower speed. Although this part of like an alternative intervention is more on the harm reduction side of things. User training, as mentioned earlier, the risk of e-scooters injuries typically occurs within the first 10 rides. It is thought that there are 2 dimensions involved in terms of lack of experience in micromobility. The first one is people may not be familiar with the operation of new vehicle types, such as e-scooters. I think, anecdotally, this is like, you see a new type of mobility, you get excited about it, you try it without having the knowledge on how to operate, knowledge to the experience to operate. The second one is people may not be familiar with the traffic rules and techniques for anticipating dangers and staying safety. Now, training new users in a safe and comfortable environment can help increase user confidence. Likewise, setting the e-scooter at a lower speed for the first few rides would help riders become familiarized, with the e-scooter operation. In the City of Richmond pilot here in BC, the shared e-scooter company made first-time riders ride at a maximum of 12 kilometers per hour for the first 3 rides to get comfortable operating the device. Next slide, please. Okay, so moving on, another tenet of safe system approach is safe roads. Building a safe network for micromobility not only keep all road users, but also all users safe, but also encourages people to participate in active travel, leading to better physical, mental, and social health. For safer roads, we look at highlighting designated roads and streets. And this is simply allowing riders to know where it is safe to use e-scooters. This can be done through proper signage where you can and cannot ride. Another is allowing online maps to integrate areas where you can ride e-scooters. So directing you to the safe route to travel and not the fastest way to get where you're going. So those are 2 different things. Now for separated a space for active travel and e-mobility use, one approach of safe system is the separation of time and space. If we have an environment with proper infrastructure for e-scooter, we are reducing or even eliminating the interaction with other road users. Some cities allow riding on sidewalks in areas where the population is less dense and infrastructures are not non-existent. Although riders should still be wary of riding on sidewalks, as some injuries occur between riders and pedestrians. Lastly, well-maintained roads with poor road conditions exacerbate incidents of falls and injuries. So many falls are due to riders losing balance or hitting stationary objects such as utility pole or street lamps. Riding on uneven surfaces like potholes or cracks can also lead to falls. It doesn't help that e-scooters have smaller wheels compared to bicycles in mitigating a fall injury. So the bigger the pothole and the smaller the wheel, the greater the risk for injury. Next slide, please. So when we talk about safe speeds, very kind of the foundational approach to Vision Zero or safe system approach is lowering speeds reduce the likelihood of severe injuries to riders, pedestrians, and other road users. So at lower speeds, riders will have more control over the device if there is a change in the road surface or challenges in navigation. Again, a great example is the city of Richmond implemented 20-kilometer speed on roads and 15-kilometer on shared pathways. So this is even lower than the BC regulations, with a speed of 24 kilometers. So geofencing will play a huge role in controlling speed on certain roads or streets. Now, going out of BC in Australia, some states set their maximum speed at 15 kilometers or at the high teens. In South Australia, they've actually applied a hefty fines for someone traveling faster than 15 kilometers, which starts at 190 Australian dollars to 2,500. Although it wasn't stated clearly how South Australians South Australian riding faster than how they implemented these fines. Unfortunately, we see a lot of e-scooter riders riding faster than 24-kilometer limit that we have, especially for those who have are privately owned e-scooters. Next slide, please. So for safe e-scooters, power affects the e-scooter maximum speed and rate of acceleration in BC. So the regulation set maximum power at 500 watts. Recommendations in Europe suggest lowering it to 250 watts. So with lower power, this will deter from carrying passengers, which causes distractions and can also reduce weight, hence reducing the kinetic energy accumulated during a collision. Reports also found that the acceleration control only operates as an on and off, so riders cannot gradually increase or decrease their speed. So this is something that we have to think of, particularly like for shared e-scooters. Now, in terms of wheel size, we mentioned several slides back that poor infrastructure such as rough or uneven roads contributes to falling of e-scooter. So a larger wheel diameter makes riding an e-scooter stable. In BC, e-scooter wheels should be no more than 430 millimeters in diameter, which is just about 17 inches. This is the kind of like the similar size of a foldable bicycle. Now, the average wheel size sold in the market is about 8.5 inches. Industry experts believe that pneumatic tires or tires that filled with air are better than solid tires because they provide better grip. What I haven't seen in any of the reports is if there is significance with the width of the tire to increase surface area coverage. Now, when we talk about brakes, more than anything else, brakes are important safety features of e-scooters. So it is recommended that a mechanically operated braking system should be available if the electric braking system malfunctions. Now, studies found that e-scooter become unstable during deceleration. So it is encouraged to have independent front and rear wheel braking systems. Brake maintenance is also critical. It is easy for privately owned e-scooter to maintain a functional brake compared to shared e-scooter rather, due to the amount of usage, exposure to the environment, and even vandalism. There's some reports that encourage covering the brake lines in case vandalism happens. Now, several studies also found that about half of shared e-scooters don't have optimal functioning braking system. And this is one, I think this is in the States. And this could result in a slow braking time and slower in achieving full stop. There are some operators for shared e-scooter. When there is a malfunction unit, it does send a signal to the manufacturer, and then it automatically disables the e-scooters, so it can't be used by riders. Now, bells are to make riders present known to road users. However, there are studies that show damaged bells are common among shared e-scooters due to potential vandalism, again, and lack of care. There are other operators now considering electronic sound with a push of a button rather than having a physical bell accessory. For lights, and obviously this is to increase your visibility at night, some e-scooters now feature turning indicators. So having indicators prevents riders from using one hand during operation to do signals, especially for people who are just learning how to ride e-scooter, where balancing is their first priority. And lastly, with batteries, among privately owned e-scooters, people are replacing their batteries with cheaper and lower quality batteries. This practice has been causing increased fire calls from firefighters in Vancouver and in New York. Though this is an indirect cause of injury from riding an e-scooter, but still people get burn injuries from explosions or even death if the fire occurred at home or in their homes. One must still follow the manufacturer's guidelines when replacing and charging batteries. And lastly, we're gonna touch on how e-scooters can a potential to address equity. So docking stations or docking hubs, as some cities would call them, prevent e-scooters from being left in the middle of the sidewalk. So pedestrians, especially people with mobility challenges, don't have to circumnavigate the obstacles. Interestingly, there are cities where shared e-scooter companies strategically place e-scooters and docking station at the start and end of a bus or a train line to use as a first and last mile transport, either to home, work, access to food, healthcare services, and other facilities where public transportation is limited. As we have learned from the Canadian Injury Prevention Conference in November last year, we learned that transportation is the most underappreciated determinant of health and well-being. Accessibility to transportation opens opportunities for employment, education, social connectedness, and addresses other determinants of health. Now, e-scooter is thought to address some of these transportation gaps. However, more research is still needed to support this claim. On top of the availability and accessibility of e-scooters, shared e-scooter programs should look at pricing to make it more affordable to riders. So we hope to see companies offer reduced cost plans for low income riders. Also, a variety of payments other than through phones or credit cards should be looked at, as some people may not have access to phones or use credit cards. Some researchers assert that a pay-per-minute method of payment may cause riders to speed up to their destination, for them to spend less. Operators should reduce their reliance on time in pricing system. Other methods could be charged for distance traveled, a charge per trip, or a monthly subscription. If let's say monthly descriptions or distance traveled payment of method is not desired, another way to look at the equity for a pay-per-minute method is stopping the clock for 90 seconds when the e-scooter is not moving. And presumably this happens during a red light or when riders are trying to avoid pedestrians. So these are like some future considerations that if there are municipalities or places, looking to use e-scooters to address transportation gaps. Next slide, please, Brendan. Yeah, so I think that's it. Thank you for listening to our presentations, and we'd be happy to entertain some questions.
Thank you, Brendan and Kirby. I'm sure our participants found that very informative. So we do have some questions and comments in the chat. Maybe I'll go through the questions first, and then if we have time, or you can feel free to read through the comments on your own. So the first question, I just lost my chat box. Here, is that speed regulated for rentals, e-scooters, private e-scooters, or both?
Yeah,
I
so
believe when you were talking about the speed limits early on in the webinar.
yeah, I can't say for certain, but I would believe that it would apply to both, because I do know in BC that we both have shared e-scooter companies as well as private e-scooters in certain communities. So I would believe it would apply to both types of e-scooters, both private and shared.
So I just want to add to that, for those participating at the BC pilot programs, they have to follow that 24-kilometer speed limits. Now for private, it's a bit tricky because we are getting a lot of imports coming from different places. And my understanding is in Quebec, they only have one operator. So it's easier, it's easier for them to regulate that speed. And then if we have private sellers, it might be a little hard to enforce that speed. But regardless, private or shared, that's the recommended maximum speed that, for e-scooter riding.
I know we have a lot of municipalities represented on this call, and I think this question would be interesting for those especially who are considering to pilot an e-scooter project in their communities. What is the recommended intervention to prevent injuries or reduce their severity? So there's 3 questions. That's the first one. Second one, safer micro-mobility infrastructure, for instance, protected lanes or separation from motor vehicle drivers. And then the third question is, what crash factors are seen in the injury events occurring on roads?
Yeah, I guess, Kirby, do you want me to start with the
Sure.
Mention piece, because I can just speak a bit to the literature there. Again, there hasn't been a lot of research into the intervention, so at least as far as what has been studied and that I've come across, it's the nighttime ban. So that'd be the intervention that receives some attention in literature and has shown it can decrease the proportion injuries, as shown in Atlanta. So that would be one to try and mitigate the risk of nighttime riding and likely other behaviors around that time, like impaired riding and such. As far as other strategies, a lot of it still needs to be, I think, sorted out literature-wise and in the research. But yeah, Kirby, if you want to add to the intervention piece, that's at least what I'm seeing in the literature so far.
Sorry, Anita. I know that's a three-pronged questions. Can you just repeat the questions for me?
Absolutely. So the first question was, what is the recommended intervention to prevent these injuries or reduce their severity?
Okay.
Second question is, or it's not really a question, it's a follow-up. Would it be safer mobility infrastructure, for instance, protected lanes or separation from motor vehicle drivers? And then the third question is, what crash factors are seen in the injury events occurring on roads?
What crash factors?
Crash factors, correct.
Okay.
Well,
So, sorry, go ahead, Brendan.
Yeah, the one point I'll just also mention, because I think it's the one that needs to be said, is also wear a helmet. That's another intervention too while riding to make sure you're protecting your brain.
So for, I think the first and second question, kind of like they're a bit tied to it in terms of, like having that infrastructure greatly reduces that severity if an injury occur. And also like speed, addressing speed. If we have a better regulated speed for an enforcement of speed for e-scooters, I think we also have to look at what are the speeds on roads where e-scooters are allowed and there is no separated bike lanes, right? So yes, we're only allowing people to speed at 20 kilometers per hour based on our regulation, or 24 kilometers an hour. And they're using a unseparated bike lane. And then a car next to it on the same road is moving at 60 kilometers per hour. Then, it defeats the purpose of keeping the scooter rider safe. I don't know if that's answered that question.
Our next question is, what is the prevalence of impaired riding?
Okay, so I was trying to get a handle on this and see how it would compare to, say, motor vehicle collisions. And I know it's not the best answer, but the data is still coming out. I think that's one of the things with e-scooters, that it's still progressing along. As mentioned, there hasn't been much in intervention space yet. But as far as prevalence for impaired riding, again, there's still more in terms of prevalence. There's been some work done into how prevalent it is among riders who are injured, but those estimates may vary. So as far as like just a general prevalence estimate, it'd be hard to say at this point.
Just to add, and I also see that there was questions regarding that we have presented limited data, which I totally agree that data limitation right now in BC is experienced. It's also a challenge right now because with our hospitalization data, different health authorities collect it differently. And we don't have a reliable tool or reliable way, and lack of resources in collecting those data. And right now, I think what e-scooter data we have is with the Ministry of Health through the health platform dashboard, if I'm correct. But yeah, we totally agree. I think that is something. There's one question that we expect that is going to come out of this webinar. But unfortunately, we kind of like don't have much to present in data.
I'm good. Country girl. Here.
Just scrolling through. Brendan, when you were speaking about the Richmond e-scooter pilot project, you mentioned about shared pathways. Do you know if that is the sidewalks or bike lanes or both? Related to the speed limits at 15 kilometers an hour.
Yeah, Kirby, do you have an idea of what it is in Richmond for their shared pathways? I believe there's some trails out in Richmond So I believe that might be it, but I know Kirby, you've been in contact.
Sorry, I'm just looking at my information here. So e-scooters are permitted on off-street paved pathways next to roadway or in parks that are signed and marked for use with pedestrians. And they're not permitted on sidewalks or on unpaved trails.
And do you know if many or most e-scooters have any kind of speedometer built into them?
That is a good question. I'm not sure. Has anyone taken a scooter lately?
I know personally I have an e-scooter and it does have a speedometer built in.
Yeah, I have read that they do. Some do have speedometers on their devices.
This is another question perhaps to the greater group and not our presenter specifically. Has anyone considered if the friction circle is applicable to the safety of an e-scooter?
Friction circles?
Friction circle or circle of forces. There's a link to Wikipedia in the chat. That's perhaps
I'm not
a discussion.
familiar. Has anyone?
Sean, I see you have your hand up. Please feel free to go ahead.
Hi, my name is Sean Peck. I'm glad that Kirby mentioned data sources, and my question. By the way, thank you for a wonderful talk and summary of all the literature. But of course, one of the things that really helps is if you can get local data. And in BC, there are many places that you can find data, whether it's potentially in emergency departments, hospital admission data, MSP data. And I was intrigued that in Kelowna, they seem to get some data on use. Could you talk about the potential for research data in British Columbia? Because if you can get local data, you could get more attention paid to this important issue.
Yeah, so just, and I know Brendan has something to say about this too. So the one in Kelowna, they've actually used the CHIRP data. It's different from the hospitalizations that normally health authorities do take. Now, in terms of research, Brendan, do you want to take on that?
Yeah, so there was a change in the coding. So in April 2022, there was a change in the coding that would allow for e-scooters to be coded in the ICD codes. Even then, there's still just been issues in terms of, what's an e-scooter injury, or like how likely is it that an e-scooter, again, just based on whether it's a four-wheel thing they're standing up on, is that an e-scooter injury, or is it just a two-wheel, ones that we tend to see in our roads too. So there is some challenges around the data coding, but there was a change recently in the ICD codes that would make research more likely. So we're hopeful that moving forward, we'd have more data, because I would agree that once we can get more data, we can give more information locally about how it would affect specifically to our communities, so that we can have a better handle of how to assess and evaluate e-scooters in those communities that we work with.
Just to add on that, so the CHIRP data that I was talking about is the Canadian Hospital Injury Reporting and Prevention Program. Not all hospitals in BC do have CHIRP data. And as for the code that Brendan was mentioning, so this is in regards to the ICD-10 code. And for e-scooters, it's only added last year in April. And another challenge to those, I guess, with hospitalization and data in general, is there is a six months at least lag for data. Yeah, so that's why like the regional health authorities doesn't have that the data. And I totally agree that that could be very useful for us in terms of policy making and decision making. I hope that answers your question, Sean. Thank you.
I'm just being cognizant of time, so maybe we'll do one more question. The injury data presented was limited to riders of e-scooters. Is there any data on injury to cyclists and pedestrians caused by interaction with e-scooters?
Yeah, so I can take this one. So as far as how interactions with the e-scooters go, most injuries that involve e-scooters are to the riders of e-scooters themselves. And part of this is because they're falling. So most of those cases will be, it's just the rider themselves falling off. Again, if they're riding on the sidewalk, they'll try and probably get over the pedestrians, and that can lead them to falling off as well. So as far as specific data or specific statistics on interactions with cyclists and such, I haven't seen much, but most injuries involving e-scooters affect the driver, and that's apparent. That's going to be an issue too in terms of impaired riding, whereas if you're driving, say, a motor vehicle and you're impaired, that can inflict harm on a person you might hit on the road. If you're impaired while riding an e-scooter, that's likely going to affect yourself as a result of getting injured from that.
Have you done any injury prevention research on other last mile electric transport devices? So for instance, electric skateboards, unicycles, or one-wheel devices?
I can take on that. We don't. There is one, and I mentioned this in the presentation. Like in Baltimore, they've actually done some equity, and that's we're kind of related to the last mile research. And this is by I believe his name is Jonathan Hassani in Baltimore. But not that I know of in BC, and we haven't done one.
We have a really interesting question. If government could make one change right now to make e-scooters safe, what one change would you recommend?
Kirby, do you want to go first?
Yeah, so I think for me, it's because now we're talking about levels of decision makers, which has that power to make a change, is to build better infrastructure to accommodate all these micromobilities that are occurring in these days. And the effect of it does not only translates into what transportation gaps meets, but the different sort greenhouse emissions, noise pollution, air pollution. So I think like that the effect was just kind of like pile up, for the betterment of the community.
Yeah, I think as far as for me, I would be kind of greedy in saying two things where with Kirvy, I would agree infrastructure wise. Again, before you go about introducing e-scooters, assessing, does your community have the proper proper infrastructure in place? Because in that way, people will use them if there's the infrastructure that makes them feel comfortable on the roads. And the second one is also around safe riders, part of the safe system where, what's the helmet use uptake going to be amongst your community? Because again, those are the severe injuries, the head trauma injuries that can be fatal. So those would be the two ones, making sure the infrastructure is appropriate and that there would be good helmet uptake amongst the community.
Thank you, Brandon and Kirby. Just cognizant of time that we are now at 11. There were a lot of questions asking if we would circulate the recording and the PowerPoint. Yes, I will be circulating this possibly tomorrow. So keep out for that email. Thank you once again, everyone, for joining us, and we'll see you next time.